to order. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law and the governor's March 15, 2020 order imposing strict limitation on the number of people that may gather in one place, this meeting of the Westborough Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and/or parties with a right and/or requirement to attend this meeting can be found on the Town of Westborough's website at town.westborough.ma.us. For this meeting, members of the public wishing to watch the meeting may do so in the following manner: westboroughTV.org. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the Town of Westborough's website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible after the meeting. Okay, with that having been said, the first item on the agenda is the minutes from the November 17th, 2020 meeting. Are there any questions or comments?
Point of order, Mr. Chair.
Yes.
I'm happy to go over the minutes. I'm just wondering, do you want to discuss the COVID reports for the past 2-3 weeks, or share your comments or thoughts, or do you want to wait?
No, I know sometimes, assuming everyone is available throughout the entire meeting, I would suggest we pick that up in director's issues. Okay. Or if you want to put it under new business, I'm okay with that. Maybe it's old business, but I wouldn't do it as part of the minutes. If
No, but yeah, okay, that's fine. Okay.
But if you, I accept that you would like this brought up, and I'm happy. I think it's we'll certainly have time for discussion of COVID issues in a little bit.
Okay.
With that, I'd like to make a motion that we accept the minutes from November 17th, 2020.
I second that.
Okay, roll call. Dr. Hashmi?
Yes.
Dr. Walsh?
Walsh, yes.
Dr. Ehrlich, yes. Okay, next item is the director's report.
I had a question. Maybe you guys can go into a little bit more about the Willows safety and how that was received, and whether there's still ongoing issues there.
Steve, you want to talk, or you want me to, or go ahead?
I can start, and then please jump in as you see fit. Yeah. So yeah, we had a cluster at the Willows, and Dr. Ehrlich and I thought it would be a good idea to have a virtual meeting with the executive manager there to talk about what they were doing, and to try to get some a letter out to the residents, just emphasizing that certain things that they should be doing and things that they shouldn't be doing, and that sort of thing. Dr. Ehrlich, I'm sure you can say it better than I did.
And then just general guidance, like, wear masks, don't hang out or eat dinner with like people that aren't in your household, and that sort of thing.
Correct.
Yeah. I don't think they agree with that, right? I think they.
Well, I'll make a few comments. Steve, I don't know if you have the letter. Can you just bring it up on the screen?
I don't have it on this laptop. I know the whole board saw it.
Okay, everyone's seen it, then that's fine.
I'm sorry, I don't have it on this laptop.
No problem. So I had originally been contacted by someone who is a family member of a resident of the Willows about concerns that this person had, and I brought them to Steve, and because of the cluster that was happening, we felt it would be useful to speak to the management. Management had already been doing many things appropriately, but you never know till you have a conversation. Is there something else they could be doing? And we did talk to them about a couple of things that they might try doing a little differently. I think one thing in particular had to do with people sometimes have very concrete understandings of the regulations, and if you're following them exactly, that means you're doing everything okay, which in general is true. But when you talk about people gathering in a room for extended periods of time, much as we had with town meeting, the risks start changing. That the duration of your exposure is as important as how close you are and other things. So even if you're wearing masks, if you're in the same room for hours and hours on end, sooner or later you're all breathing the same air. And talking to them about issues around like when they're having a movie or whatever, understanding how they might lessen risk and things like that. So
Good.
that was some of the tenor of the conversation was all constructive. And then I did think there would seem to be this notion that if a letter came from us, I guess we all signed it, that it might have a little more importance in the eyes of the residents, that might get more attention than just coming from management.
Good.
And I think that might bear, we'll see what happens when, I know in a little bit we're going to talk about the Highlands and what's happening there, because I came up with some of the reports, and whether or not perhaps a letter might be useful from the board there also, just alerting them that they are a high-risk population. I think that's all I wanted to supplement what Steve said, but if there are any additional questions, again, I'm happy to answer, Steve.
So wait, Dr. Ehrlich or Steve, either of you, aren't the residents? First, thank you for doing this. This has been a concern of mine, as you're aware previously. But aren't the residents also, at least in the Willows, supposed to be quarantined in their rooms? Am I right about that?
No. So they're independent living. Okay. So this is not Beaumont, which are right next to each other. It's not the nursing home facility. It is independent or, assisted it's semi-independent living. They do have communal areas where they can eat, and that has been shut down. So they're not eating communally. Meals are being delivered to them. But if they want to go shopping over at Stop and Shop, they can walk or get in their car, and there's no restrictions on their movement in that regard. And
what about and they can meet fellow residents? Is that right?
Within certain rules. Steve, you want to elaborate?
I'm sorry. Can you say that again? You're very faint for me, Syed.
Sorry, Steve. I was under the impression that they're essentially confined to their rooms. I guess Dr. Ehrlich is saying that is incorrect. Am I?
No, that's incorrect. They are independent living. They can get in their cars if they can drive and go wherever they want. They've been asked to stay in their rooms, but there's no one is there. If they want to exit their room and go 2 doors down to their neighbor, they're
in many ways, it's like an apartment complex, but with some added benefits in terms of services that they provide, right?
And there are some communal activities which they've either stopped or only engaged in with specific restrictions.
Okay, thank you. Thank you very much.
I want to eventually hit the topic of vaccines, but I'd like to postpone that till kind of near the end if we can, and kind of run through all our normal business, if that's all right.
Sure.
Yep.
And then I wanted to, so can we keep going with the director's report or?
Yep.
Dr. Ehrlich? Okay.
Yep.
Dr. Walsh, did you have anything else on the director's report?
Nope, that was all I had.
So do you mind if I
take it away?
All right. So, Steve, thank you again for the Lake Chauncey update. Any further details that you want to add? One of the things that we were interested in is having a comprehensive plan for the lake moving forward. Is that what you were discussing with the rec director, conservation director?
Correct. So, as you know, because of the algae blooms that we've had over there over the past several years. We wanted to look into having a comprehensive study of the lake to try to figure out, where they may be coming from and things we might be able to do. The meeting I was involved in, the rec director was there, assistant town manager, and also the conservation commission director. They are going to take the lead in this, just for obvious reasons that we have slammed with other things.
No, absolutely.
So I've kind of backed out of those meetings a little bit, but it looks like they're. I know that the conservation director and the assistant town manager are talking to each other as far as maybe getting something together for perhaps town meeting in March.
Okay, and I noticed also that the hazardous waste day is back on.
Yeah, we had our budget meeting. I put in for it. Again, we still have to go through all those different hurdles, so we'll see.
Okay. All right. And then again, I wanted to thank Dr. Ehrlich and Steve both for their help with the town meeting. So just a shout out for that. And then you mentioned in your report that you had a turnout less than I expected, 80 vaccinations. Do you know if that is about how much lower that is
Well,
compared to you? Sorry.
sure. Yeah, well, just it wasn't a lot lower. We usually do somewhere in the 90s. So
Oh,
not a
okay.
lot, but I thought we'd get more, but it is what it is. And I'm sure the people that got vaccinated were happy that we did it.
I also would like to just point out, and Paula, if you're taking notes on this part, it was Dr. Walsh who helped with town meeting, not myself.
Sorry. Yes. Sorry. Yes, and both of you have done an incredible job. Okay, how about that?
It's a good team we have here. About the flu clinic, yeah, I think that we had originally asked for more than the 80 or 90 because we were expecting, with everyone being very concerned about respiratory illnesses, that we'd get a lot more people coming in. We didn't see that, though. We kind of saw about what we would normally get, which, as Steve said, was 80.
Yeah. And we ran it for a longer period than usual and with more nurses in order to space everyone out, just to be very precautious. So, I think that people were well protected coming in. We had very, very little crowds and got people in and out very quickly.
Okay.
Any other questions?
No, thank you.
Okay, can we have a motion to accept?
I'll make a motion that we accept the director's report for November.
I second that.
Okay. Doing roll call vote. Dr. Hashmi,
Yes.
Dr. Walsh,
Walsh, yes.
and Dr. Ehrlich, yes. Okay. We can probably get to the sanitarians report before we get on to the next item of the agenda.
Yeah,
go ahead.
Go ahead, Dr. Walsh.
I was going to ask about the, we have a large number of businesses that seem like we're still getting complaints about. And it's a general question. How do we educate people to kind of stay spread out? I mean, if we can't get them to spread out, I don't want to shut down places. I don't know how to educate people, though.
Well, the way I don't know if you're asking me a question. I'm sorry, doctor.
Let me just say, we're 9 months into this thing. Okay, everybody knows. Okay, now how much people are willing to adhere is a different issue, but education seems to me to be sort of something that was for 6 months ago. So Ray, what happens when you try and address compliance more than education? I guess. Go ahead.
Yeah, I have had a few that I've had to go into. Toyota was one that's kind of one that we've had issues with in the past. I talked to the floor manager. He got on the computer, pulled up the video for the dates that I told him, and he said, aha, I got it. That person will never do that again. And since then, it's been a couple weeks. I haven't heard from anything, which is good because they were about every 2 weeks we were getting a call from them. Some of the others are newer. Midas was the first time. For golf was they fired an employee, and the employee's boyfriend had booked 27 hours of time, and no one showed up for those times for golf. So they were trying to really stick it to them. And when the woman called me on the phone, when I explained to her that I had been out there when they opened and that everything they did was fine, she kind of got in a huff with me and then got off the phone and never complained again. I did talk to them about it, and they said that they would make sure everybody's wearing masks. But other than that, it's just the same thing, extended stay. I just got to go out there and tell them, hey, and they're like, yeah, we tell the people, but people come out of the elevator not wearing a mask, and then they leave, and there's not much they can really do about it. Some businesses in town, like the Shell station on Route 9, it's company policy not to tell people to put masks on. They have big, huge signs in the door that are 2 feet by 3 feet, and they said if they don't see that, or if they do see it and decide not to wear a mask, they're looking for a fight, and we're not going to give it to them.
Okay, so with those words of encouragement, Dr. Walsh. Any other questions for Ray? I did. It struck me, by the way, your report is much shorter when you're spending half your time doing COVID.
It's like 75% of the time doing COVID.
Ray, about this extended stay East Main.
Yes.
sorry to hear about the death. Was this like a long term? I mean, it says that the police came to do a wellness check. Was this a long? Can you expand on this? Was this a long term?
All I got from the hotel was that there was an odor. The hotel called the police so they could go in with the police, and they found the person dead. He looked like he'd been dead for a day or two. It's just they said it kind of happens with transient population. The guy, I didn't get into too much with them. They just told me because I got an odor complaint, and they told me what the odor was and how they were fixing it, and I said thank you very much, and I wasn't going to look at it.
Yeah.
Okay. Okay. All right.
Good. I make a motion that we accept the sanitarians report for November.
I second.
Okay. Doing roll call vote, Dr. Walsh,
Walsh, yes.
Dr. Hashmi,
Yes.
and Dr. Ehrlich. Ehrlich, yes. Okay. It's 5:47. We have on the agenda for 5:45 discussion of the notice of the Tier 2 classification document from the former state hospital. We've all received it in our packets, and this pertains to some a spillage of chemicals that would trigger what looks like a site investigation report, followed by some management according to the DEP. So with that as sort of framing, perhaps Steve, you could run us through just the highlights and what, if anything, we ought to be aware of or need to know.
Sure. So Dr. Hashmi had asked me to put this on the agenda to discuss a little background about these types of reports. We get them quite frequently. I would say probably every gas station that has been older than 20 years old has a report like this on file. We get them for the Mass Pike. We get them for mile markers on the Mass Pike. Like if there's an accident and like there's a fuel spill, we'll get a notice that there was a fuel spill at mile marker, 22 on this date. So we get these a lot. This whole system, as you had said, is overseen by DEP. They have a system where if there is a spill or a release on a private property, that property owner has to hire a licensed site professional. That person is in charge of evaluating, what the extent of any kind of environmental, hazards and what the cleanup will be. And they work with DEP as far as coming to a resolution, depending upon, what the release is. Generally, we act as a repository. We get them and we file them. All this information is also available online. You can go on the DEP's website and look up any address, and they'll tell you if there's any kind of release notifications for that address. So, this one's kind of, it would appear fairly, normal. It looks like there was a transformer that either was hit or damaged and spilled some chemical into the ground. It looks like they did some soil borings and then also did some wells. It looks like it's still under evaluation as far as, what impacts to the groundwater it might have. But some of that monitoring can take time to come out in the wash. So,
can I add to that, Steve?
Okay, let's do it this way. Hashmi, Walsh, and then myself.
Okay. So
You're first,
okay.
Hashmi.
Okay. So thank you for Steve for summarizing that, and thank you for putting this on the agenda. I got kind of interested in this, and I had reached out to Steve to put this on the agenda because one of the concerns that I initially had with this was this occurred way back in March of 2019. So courtesy of Steve, I had actually reached out to Mark Baldy at the Department of Environmental Protection and spoke to him on the 11th of December. And as Steve said, there are various classifications. There's a protocol that is done through these private contracting companies. So there's a phase 1, and then there's a phase 2, which apparently it takes 3 years to do the complete cleanup. I guess this is a question. The reason I asked Steve to put this on the agenda was, as he mentioned, when I talked to Mark Baldy, he mentioned that when stuff like this happens, they inform, and as Steve said, that they inform the Board of Health, and it becomes a repository of information like this. And I recognize that Steve probably gets like tons of notices and has to sift through what he informs the board and what he doesn't inform the board. I guess I'm because this came via DEP to us. Apparently, he said that he had informed the Board of Health like sometime in August of last year. I looked at my notes and I never got a notification about this. So my question to the board is that, recognizing Steve gets this, recognizing he's got a lot on his plate, is this something that the rest of the members of the board would like to be informed about? I certainly would have liked to know, but I'm asking, is this something that we want to know? I'm asking the board.
Sure. Nathan?
So first, a comment on Syed's question as to whether we'd like to be informed about these. I think that some of it depends on how common these are. I mean, obviously, if there are 30 a week or 30 a month, whenever we have our meeting, that's too much for me to really process. If it's 3 times a year that we get a report, then I don't think it's too much. So that would be kind of somewhere in that range is kind of where my toleration is for these type of reports. I had a question for you, Stephen, that you said that we do get these type of reports fairly often at different sites along the highways and stuff. I was wondering whether these are specific for trichloroethylene or whether the reports are just DEP reports and maybe it's about fuel and other things, because TCE is a little bit different than other types of petroleum products in terms of how it interferes with groundwater.
Yeah, and I'll just preface this by saying I am in no way an expert on how this whole program works. It's very, being a licensed site professional is not easy, and I don't have the background. But we get them for all type. We get it for gas, oil, all types of different chemicals. So, what trips that threshold as far as whether the chemical is reported or not, I don't have. I don't know. I know it's a quantity amount, but what the specific chemical, which chemicals get reported to us, which don't, I couldn't tell you. But mostly they're VOCs and other chemicals. So.
Well, you're not alone, Steve. In the report, there's actually a few typos and stuff like that around the name of the chemical as well. I believe that TCE is trichloroethylene, and the report actually states it as trichloroethene, which are different, I believe. And so there are also, issues there. But this is heavier than water, and it does tend to sink into the soils vertically downward. And the report here states that not just that a transformer might have blown or leaked, but the report actually, if I can find it, I think it explicitly said that they suspected, the source of the TCE impacts in the soil and or groundwater is suspected to be associated dumping of spent degreasing solvents behind building 18, which is a little bit different than just saying that maybe a transformer leaked. This made it sound more like there was an active process there.
I certainly got that same impression, but I assumed it meant from prior to Pulte taking over the site. That this was, some workers when it was Westborough State Hospital, and you just dump stuff to the ground because it goes away and that kind of thing back in the day.
I also think that this was used as an anesthetic back in the day as well. It's also possible that it had more of a hospital use than a degreasing use.
I wanted to just make a couple quick comments. The first, just because I know this is being recorded and people may be watching either now or in the future. So to the extent that acronyms are used, it's good to explain them. When Steve mentions VOCs, those are volatile organic compounds. The second thing is, it's not clear to me why this is coming to us, in that this seems more like it's something that would fall under the purview of the Conservation Commission. Do they also get these reports? And if they don't, sort of why is it considered Board of Health per se as opposed to more environmental things?
Yeah, don't know. I know that the selectmen get, I believe Christie gets a copy as being the town manager. Sometimes I do see they CC the Conservation Commission. This one I don't think they did. I'm sure that's all spelled out in the regulations. We used to get, 20 years ago, we get different people looking to buy properties constantly coming in our office looking for this stuff because we were the repository to do a file search. Now we hardly ever get anyone coming in because all this can be done online. I'm guessing that, boards of health were just designated the repository because your guess is as good as mine. So,
Okay.
don't know.
So I have a question, and that is, do we test for TCE in our pumping stations? I know that there's some drinking water pumping stations right there near Lake Chauncey. If there is a tier 2, leak of TCE in the state hospital property, I think they said that they didn't think that it had penetrated down into the deep non-aqueous phase, which would be concerning. So that's makes it seem a little bit better. But I didn't know if we're actually testing for that, or whether it might be worth testing some of our drinking water for TCE.
I don't know. I can reach out to Kevin Carlstrom, who is the manager at the water treatment plant, to find out if that's a normally tested substance that they test for.
I agree. And if they have the ability to test specifically from those wells near Lake Chauncey, that would be good, so you're not getting a dilution from other areas.
And just to add, I got the impression when I talked to Mark Baldy at the DEP that was being done. But Steve, you might just want to just double check. The other thing, and just to follow along with what Dr. Walsh and Ehrlich have also mentioned, in the report on page 3, the first paragraph states, the risk characterization which do not exceed the corresponding standards. However, the vertical extent of TCE impacts to groundwater have not been defined. And when I asked specifically about that, and potentially the remediation for that, apparently that process, once the clock starts ticking, Ranson has 3 years to get this done, and during this time, it is incumbent on them to basically notify the Board of Health at least about what's going on. And so as we move forward with this, so again, the reason I put this on was to inform, potentially educate the board about this process, and then to ask if there are such releases in the future, whether A, you want to be informed, or B, would you like to keep? I would certainly like to know what's going on with this. So, but I leave that to the board.
So my feeling on what I want to be informed about is somewhat different than Nathan's. Nathan gave sort of parameters based on frequency, and I would suggest that I am more concerned based on the potential for impact to citizens of the town. So if there's a spillage along the Mass Pike, far away from where anyone's living, I guess I care less about that. And if we have a spill on East Main Street, near, or West Main Street, let's say near in a residential area, then I care a lot more. So, and again, in your reports, Steve and Paul's before you, when we have had spills, when it's a significant thing that shows up in your reports. So at some level, I trust your judgment, but I think if anything, at least the three of us giving you advice on what the threshold is helpful. So for me, it's what's the impact on the citizens more than the frequency or, whatnot. And that's how I would prioritize. And again, Sad, I don't know if you have a preference, but
I'd like to know about them.
You want to know about all of them?
I mean, I would like to know it's, because for instance, I'll give you I guess the reason I was somewhat surprised by this is, for instance, way back when, and I don't remember exactly when, there was, we found, when, like, what is when restaurants dump their stuff outside their drains in the stormwater?
You talking about the grease traps or?
The grease traps, right? I mean, there was somebody that, we were told about, like, I think there was something, one of the restaurants did that. It really contaminated their stormwater drain and everything. And that, stayed with me. I remembered that. I don't remember the exact circumstances, but I do remember. And so that was part of our report. It was brought to the board's attention. We knew about it. Here we have a volatile compound, with its own risks. And, this happened, and DEP is reaching out to the board. And again, I'm sure that we get plenty of these reports, but I'm thinking this would have been I would have appreciated, I think, maybe knowing about this. And so that's kind of that's where I'm coming from, and I'm just trying to get and again, it's to help Steve out in what he informs the board and what he doesn't. I mean, because I'm sure he's getting plenty of reports, especially now with COVID, and what are the circumstances that rise for him to put it as part of our packet.
Listen, I'll just start putting them in there, and then we'll just see how it goes. And if it gets to be too much, we'll talk about it at that time.
Okay, thanks, Steve. Would that be okay?
What I would say is, I don't think we need it on the agenda unless there's a specific interest. You can just include it as an FYI.
Seems reasonable to me.
Okay. I don't see any issues with respect to that, so I think we can go on then to the health inspector's report.
Wait, is this part of the new business? Are we going to be discussing, so going back to what Dr. Walsh had mentioned, the vaccine, are we going to do that in director's issues or?
Yeah, I think that'd be the best time to handle it.
Okay.
Yeah, so
I'll leave it up to
which isn't very far in the future, because all we have is Aaron's report.
Okay.
So we're now up to the health inspector's report.
So who wants to go first?
Feel free.
Sapporo. Weren't they already like on the, weren't they issues before? Didn't we call them in?
Sapporo has new owners. Gosh, it's been a while now. Ray, do you remember when he started? It's been about a year. Yeah.
You're on mute, Ray. Okay.
Yeah. So I was there recently. They obviously had a lot of issues going on. One of their big issues was with their sushi, which was very disappointing. So I did close that area down when I went back for a reinspection. The fire department also was there, totally unrelated to my inspection actually, but they closed the same day that I had closed the sushi operation for their hood compliance. But I have been back in the meantime twice actually, just to kind of pop in, and they're back in order.
So they don't need to be called into the principal's office. They're okay.
I mean, we definitely need to keep an eye on them.
Can we talk about the Highlands at this point? It sounds like you got two separate complaints related to the Highlands.
We did. The Highlands, Steve had got the first complaint and had spoken to a resident whose mother, I believe, is there. Sorry, go ahead, Steve.
Oh, no. I mean, I'm sure you remember it a lot better than I do. So it was a family member that was there, and she just had general concerns about mask usage amongst the people in the common areas. I don't know if we had talked to the manager there, and he claimed that a lot of it was due to some of the patients. They got a little bit of dementia. Maybe they don't remember to put the masks on when they leave their rooms. They say when they see it, they try to jump on it as quick as they can, just a friendly reminder to people. And generally, they have good. It works out that way, but. That was, I think, what he said was part of the problem. And I know Erin went there, so you can kind of tell what you saw.
Right. No, that was exactly it. There are individuals there that do have memory issues, so they're constantly working with them and their families. They actually have posters that they're trying to put in the residents' room. They just have to get approval from their family members before they can put things on their walls. So they were working on that. I have not gone back actually to see if they have put those up, but we haven't heard back from the residents that had called.
So I had two questions. One is, it seems like contact tracing may have slipped twice, if I'm reading this correctly, kind of at Buick and Uno's. And just trying to want to figure out if it really was a slippage or if this is just the normal process of working through contact tracing. But what can we do different if there's a problem?
Sure. So all Westborough businesses are supposed to contact us if they have an employee test positive. Um, a lot of them do not. And in these cases, we actually were contacted by employees there that were concerned. They were not aware of all the steps they needed to do in contact tracing. So they thought that if everyone tests negative, they can all go back to work, no problem. So I did walk them through those steps on actual contact tracing and quarantining. And they both, were in compliance with those. We had a few people from Westborough, from both places that ended up being in quarantine.
Is it possible for us to do a blast email to businesses in town and just kind of highlight, at least if you have someone that tests positive, contact the Board of Health at the very minimum, but, possibly outlining some of the other steps that they should be doing as well. If there's a lot of businesses that aren't aware of that, there is the high chance that there are businesses that nobody's told us about that might need to be doing stuff differently.
We can blast out, but we don't have a list of every business in town.
No, if we cover, the 80-20 rule, right? If you get 80% of them with 20% of the effort, that's how we want to do it.
Yeah, I'm happy to draft something.
What was that, Aaron?
Oh, I'm happy to draft something to send out. The only information I have is for people who have a food permit.
Yep.
So that would be our list. Maybe another department has other contacts we can send them to.
Yeah, I think if we send it to our contacts and we, hand it off to like the selectmen or, we've got like an economic development committee or something like that, send it off to somebody else and just say, here's our draft letter. If you have contacts for other businesses in town, feel free to forward it. The more people we hit, I think the better off Westborough will be.
Okay. Other comments about the health inspector's report?
One other one, and that's you visited a lot of churches, and a lot of them seem like they might not have a lot of active attendance. We do want to just remind people that if they go back to use a facility that they haven't used in a while, to make sure that you flush all the water pipes and things like that. The kind of reopening guidance. I'm not sure we're yet to reopen, but sometimes, might be, we just have to figure out how to remind people to, handle their stuff properly.
Mm-hmm.
We don't want Legionnaire's disease on top of everything else.
Okay. Can I have a motion to accept?
I'll make that motion.
I second the motion.
Okay. All in favor of we'll do roll call for accepting the minutes of the health inspector's report. So Dr. Walsh?
Walsh, yes.
Dr. Hashmi?
Yes.
And Dr. Ehrlich? Ehrlich, yes. Okay. That brings us to director's issues.
Sure. So I think we wanted, why don't we handle you had questions about vaccines, Dr. Walsh. Want to start there, I guess, maybe?
I'm happy to start there.
Start with the numbers. Do
Okay.
you want to do the numbers first?
Well, I issue the report every Friday. I don't, numbers are going up. Last Friday, I think we had either 82 or 86 cases, highest we've had. We're busy. We're very busy. Aaron and Ray are just working, all around the clock doing this stuff. We have had to rely on the CTC a lot more than in the past. The numbers are just too much for us to do all the cases. We're no different, as with the rest of the state and with the rest of the towns. We're not any different. We're seeing a rise just like everybody else.
Steve, on that point about the CTC, because you and I have spoken about this. So when we utilize the CTC for the contact tracing, what they don't do is they don't give us the same degree of information about who's quarantining amongst Westborough residents that we get when, say, Ray or Aaron or Steve is doing that type of follow-up. So going forward, because we can't do it all ourselves, those quarantine numbers are going to be somewhat inaccurate. The rest of the numbers, the number of cases, the number of hospitalizations, the number of deaths, will probably be pretty close to accurate, but the quarantine numbers will be less so. I think that's just something we have to accept, given the resource limitations we have. And the most important thing is, I think, for us to be trying to document the cases and giving us at least a consistent number to track in that regard.
Maybe on the report we need an asterisk then that just says that it doesn't include quarantine cases that are handled by the CTC.
Yep.
Yeah, because we're talking. Yeah, because just to let you know, we're talking two different systems. So the system that Erin and Ray and I use is called Maven. It's all boards of health use it. It's confidential. It's not only for COVID, it's for every communicable disease. The system that the contact tracers use, they do not have access to Maven like that. It's a abridged system. I've never seen it, but they don't have all. It doesn't have all the functionality that Maven does, and the information does not flow back and forth between the two systems. So if we wanted to get information on a specific case, we actually have to call someone at the CTC, give them the number, question, so that's even more time consuming than if we did it ourselves. So that's the reason we have that just to give you a reason why it is that way. And so.
Wow. So Steve, and this is a question for Steve and Dr. Ehrlich. Do you think that this is a post-Thanksgiving rise, or is that kind of what is that?
So I'll tell you, I don't think so. And the reason is that the rise started well before Thanksgiving. And if you look at the shape of the curve, it hasn't changed all that much. I may be able to put something on the screen that can document that. But go ahead, Steve, if you want to comment on this.
Tough to know. I mean, the problem with doing contact tracing, and Erin and Ray will certainly, they can confirm this, is that people don't tell us the truth. So, we call people, they'll say, oh, I'm the only one that lives in their apartment or the household. Then a week later, we get another case from the same address, right? So whether...
I get it.
That's a problem, right? So if people aren't, it's hard to associate anything with what's being, what's going on sometimes.
But also, Steve, again, please feel free to correct me if I'm wrong, but it appears that the age distribution is also skewing towards the younger population. At least that's the impression I'm getting. Is that correct, would you say?
Ray and Erin, you've done the most lately. I think for the most part, yes. I mean, the older age groups have been less cases. Although that has been going up also recently.
Okay.
Yeah, it's kind of across the board. A lot of young, a lot of everyone.
And Steve, and I know we talked about this before, but once somebody, for instance, forgetting the CTC, but once somebody enters Maven at least, right, that document is that information is there long term. Yes, I mean that. Sorry. Go ahead.
Forever. You could go back and look up, people's tests for different diseases that are communicable for going back, decades on it. So yeah.
Okay. Thank you.
Okay, is it possible for me to share my screen from this view here? It says present now. I'm just going to try and do this just to share your entire screen. We'll go with that. Okay, and if you can see my screen, just let me know.
Yep, we can see it.
Okay, so this is from a site, World Odometer, and this is daily cases in Massachusetts, and they get this from the Mass DPH. So if you look at here, this is November 26th, right here. I'm having trouble getting right on the 26th, but this is 27th. So this is right after Thanksgiving. And you can see that there was a steady rise beforehand. And then, yes, we've gone up since then, but that continued rise was happening the day after Thanksgiving and, the weekend after, even before you would normally expect some kind of delayed incubation period. So clearly, this is back in the springtime when Massachusetts was one of the hardest hit states, and you can see we're now in uncharted territory in terms of new cases. On the other hand, if you come down here and you look at deaths, this was deaths in Massachusetts on a daily basis. It peaked in the spring near 200. And, these are 7-day moving averages, the line that you see. And you can see that deaths have been going up, although not nearly as sharply as the cases. And a lot of that is related to the need to, we're doing a lot more testing. We do testing of asymptomatic people. We do testing of contacts as part of, the aggressive contact tracing. And so we are identifying more people with the disease. Clearly, there is more widespread disease than there was before. And you can see that the deaths are trending up, although thankfully not as rapidly. So it helps put that in perspective of what's going on. Some of this is attributable to probably some Thanksgiving behavior, but a lot of it is just, you can see we're still on the left-hand side of the curve going up. We haven't really plateaued yet. Okay, so I just thought that might be useful to see.
But I think also, sir, Dr. Ehrlich, correct me if I'm wrong here, but the fact that, again, I'm glad that deaths are not going up, but that's also a reflection early on that the population that got sick was older, sicker.
That's certainly true. There are other things. We're better at treating the disease now.
Better at treating a disease. We have
more experience knowing what drugs work and what drugs don't, what you should give and what you shouldn't give, things like that.
Okay. And I would just point out, in case anybody is really listening, there was a recent paper that looked at the fact that there are these that the risk of a outbreak extends long after. It's just not one or two people. It can go on. And the classic example that one of the recent paper looked at was the Biogen outbreak, which seeded or helped to seed the epidemic or pandemic in Massachusetts. And they have now calculated from that one conference, 300,000 people got sick. That's a huge number of people from one event. And I guess it goes to, everything that we've been talking about for several months, that we ultimately, all of us need to protect each other, because we do not know downstream how far, who we met, or as Steve has already alluded to, contact tracing is exceedingly difficult. It's hard to say who I met or who I didn't meet. I mean, it puts them in the line of fire.
Okay, so any other comments or questions about COVID and where things stand with that?
If there aren't, I would like to transition it to talking about the vaccine and how that might affect Westborough. So it's sort of COVID related, but if there's
COVID related, that's good enough.
And so obviously the first vaccine has been approved. It's now being shipped and distributed. I was wondering if, Steve, if we've been contacted by the state at all, or we're at all involved in the implementation, or are they just doing it on their own?
So the main contact we've had so far is, we belong, the vaccine unit here in Massachusetts. We obviously belong to them for flu vaccine, and then also for our childhood vaccines that we were doing before COVID hit. But they reached out maybe last week, maybe the week before, with a questionnaire as far as what types of storage facilities we have, how many doses we could take. Dr. Ehrlich had to review a lot of paperwork. Thank you for doing that, Dr. Ehrlich, as our medical director. I had to have the selectman, Shelby, had to sign off on it. So we have been working towards being approved to receive the vaccine. I actually just submitted that today. So the next step, I don't know. It's still very preliminary. Some of the state conference calls, and I was not on the last one. This is where I'd ask Aaron or Ray to step in. They did kind of allude to what our role would be at the last call as far as boards of health. And please, Ray or Aaron, you can kind of summarize what they were talking about, if you could.
Yeah, we're at the tail end. Where the boards of health were the last ones that are going to be on the food chain. It starts with hospitals, senior living facilities, first responders. It goes down the list. Then you get to doctor's offices, CVS's, and different pharmacies. And there was something else. And then we were at the very bottom. So it's kind of like Dr. Ehrlich had said with the flu vaccine is they want to get it to the people through the best way possible. And then we pick up the stragglers is kind of how it's going to work out.
Yeah, I think also you have the issue of not having unlimited vaccine, and so there's going to be prioritization of which class of individuals gets it in what order. I think if it was one of these things where there was no prioritization, you just wanted to have a mass immunization, then it would make more sense for the Board of Health to have a bigger role where you organize in one of the schools and people just line up and everybody gets their shots. But in this case, there's clearly, nursing homes are high priority, emergency room clinicians, healthcare providers are going to be frontline people. Those types of individuals are going to get it first, and then it'll spread out in I think a staggered fashion.
Yeah, and so with the higher risk groups being targeted first, that makes a lot of sense. We do have a lot of nursing homes and elderly living facilities here in town. Is there a plan for where they fall in terms of when they will get vaccines, and have they already started even? I'm not aware of what the strategy is, and so just for us to be aware as far as the Board of Health of what's going on in our town, I didn't know if there was data provided to us.
So what I would say is every facility like that has a medical director of their own, and they're going to work with the state that is overseeing. The State Department of Public Health oversees these facilities. Steve, I don't know if you want to elaborate any further.
Yeah, they, and I'm just going off of memory here. I think long-term care facilities, they were like in phase 2, if I'm correct, after the hospitals and things. So I would think they're right there in the beginning. So I don't know. I would assume they would, those facilities typically have, as Dr. Oak said, the medical director and have medical staff. So I would assume that the vaccine would go straight to those facilities, and they're probably filling out the same paperwork that I filled, I'm guessing. So, I'm guessing, again, I'm just guessing, but I'm assuming that's probably how that will work.
Because we don't supply them with flu vaccine. They get their own flu vaccine. Yeah.
No, we way back again, like 20 years ago, we were the repository for all the vaccine in town. If you were a physician's office with state supplied flu vaccine, you had to come to our office to get the vaccine. They stopped that. Now it's direct shipped. It's a little history. So no, we do not supply the flu to them.
And then I just want to make one other comment about the vaccine, and that the initial data does seem to indicate that it is safe and effective, and that those people that are in these high-risk groups that are being targeted first, my view is that they should be signing up to get the vaccine, unless they've got some other underlying medical condition that would prevent it. But I'm not a doctor, and so I don't want to necessarily give doctor advice, but as a scientist, from the data that I've seen, it does seem to be very safe and effective.
Actually, could I follow up on that, Dr. Walsh?
Sure.
Because we have both a scientist and a physician. So I just had a couple of questions, open-ended questions. One, at least from, and this goes back to stuff that Steve said, the vaccine that we're currently talking about is the Pfizer Moderna vaccine, which needs to be refrigerated at like -94. Is that correct, Steve? It's like some crazy temperature, right?
Yeah. There's 2 different vaccines. Yeah, one is Pfizer, one is Moderna, and that both of them, it's -94 Fahrenheit or -80 Celsius.
Right. It's like this crazy temperature that they can. So that's one. And my question is that, this is, with regards to polio, we had there was a long incremental process to developing the vaccine. This has been certainly an accelerated process. And, as best as I know, the vaccines have been tested against the virus, but they have not been tested against each other in a head-to-head trial.
That is correct.
Am I correct on this? They've
Yes.
been tested as the virus in the wild.
Compare the two different virus. Yeah, there's very little data that would compare the 2 different vaccines as far as which one is more effective.
Effective, right? That's at least my understanding of the literature, right? It's effective against I mean, we know the data of effectiveness
It's
against
effective
the
against
virus
compared to not being immunized. So
and
it's
not being immunized. Yes.
absolute efficacy, not comparative efficacy.
Thank you. See, this is what happens when you have an epidemiologist on the, the Board of Health. Someone who teaches it, you know the verbiage.
Yeah, yeah.
And I'm just asking, Dr. Ehrlich, how does that like fit in with, because the vaccines have not been tested against each other. How does that fit with you? I mean, I'm just want your input, advice. How do you think about this?
The reality is that it's often hard to do those types of comparisons for things that have not been approved in the first place. If you get a new drug, you can compare it to the existing drug that it's attempting to replace or whatever. Or at some point, a public health group might want to do a comparison between two well-established drugs to see which is superior to which. But in this case, they're all coming to market as soon as they have demonstrated that they work. There may be a study that compares one to another in the future, but for now, that's not happening. And given the rate at which people are dying, the imperative is just to get something out that works. So the answer to your question is, in an ideal world, it'd be nice to have the luxury of time to say, oh, we have got 3 different ones, which one makes the most sense? Maybe we'd have a chance to compare adverse events with the different ones. But given the urgency of the situation, more than 1,000 people a day dying in the country, day in, day out, every single day, it's really imperative to just get something out there that is effective. I just want to point out, you brought up the temperature thing. We don't have a freezer at that level. And so whatever we do in terms of supplying immunization to members, citizens of Westborough, it isn't going to be from this round of vaccine. It's going to have to be a later vaccine because we can't adequately safeguard the vaccine at the right temperature.
Yeah, I mean, the only way it would happen is if it was a 1-day event and we had it shipped on dry ice and we basically were, using it out of the dry ice. That's the only way that we would be able to maintain that temperature.
Yeah, but Ross, even then there's a problem. I think and Steve, maybe you can speak to this. I think you can only access it, like you can open whatever container. There's like a specific container that the vaccine comes in or something that keeps it at that temperature, and you can access that like twice.
Well, in any event, it's not something we have to worry about for the time being.
To the bottom,
Ray,
Alan said.
Yeah, Ray, go ahead.
So in the last call I was on, I think it was Friday, they said there are only 8 freezers in the state that keep it at that temperature, and they're all hospitals. So no local boards of health or pharmacies will be getting the one that goes down to -80.
Which is the Pfizer one.
Yeah, that will all be going to hospitals and healthcare facilities and storage like that. We will not be seeing that at all.
Yeah, my employer has several, but we store all sorts of super bugs in there that for detection. So we couldn't even use those if we wanted to.
Yeah, I'll change that. They had 8 that were in hospitals in the state that could be used for the virus.
Okay. So the reality is, I think we're likely to see another vaccine approved in the next month. I even want to change that language, because the Pfizer vaccine was not approved. It is not FDA approved. It has emergency use authorization, which is a different level. And so I expect we'll see something like that, probably with the Moderna vaccine, within another month or two. And then I believe probably a month or two later, there may be yet another vaccine. So we'll see as each one comes out. Again, right now, the highest risk people are the ones being targeted, where, if there are some side effects, it's probably an acceptable trade-off. And as time goes and we, after a few million doses, if there are problems, it will become more apparent. They obviously look for these things during the trials, and the trials for these vaccines have been fairly large. I think my recollection is on the orders of tens of thousands of participants. But it's not till you get out in the community that sometimes things come up that wasn't detected initially. So I think it's all going to unfold over the next month or two, and hopefully it will be effective and it will stem this rising tide of infection and death.
Do I want to bring the doom? Sorry to be a doomsayer, but there's also a new strain that has been picked up in England also. So it's going to be, this is still very much a disease in evolution.
Okay. Any other issues related to any aspect of COVID, or else we'll go on to other directors' issues?
Well, I just wanted to just for the board's private information, I had just included with the packet an interesting article I came across that we look at our COVID numbers in the context of like town boundaries, and I just thought this was an interesting article for the board to consider that it's not the town boundaries that define us so much as our other boundaries, commuter flows and such. So I just thought that was an interesting article for the board to consider as we.
For anyone listening in, the article is from Commonwealth Magazine. It is dated November 22nd, 2020 by Garrett-Nelson, and it is titled "The Dysfunctional Geography of Ancient Borders in a Modern Pandemic." I looked at it; it was interesting, but I'm not sure it, affects at least us out here in Westborough, where we, have discrete borders. And what I thought the article ignored is the fact that these so-called artificial boundaries have real effects, such as where kids go to school, and how we do our contact tracing and things like that. So, for better or worse,
I had a very similar feeling to yours, Alan, in reading this, is that I thought it left out the fact that regulations are applied town-wide, and that what is allowed in one town may not be allowed in another town. And that those borders, even if they're not physical walls, they do affect, what can happen in each town. You're right, though, that the traffic across towns and the traffic across borders does kind of blur things like, infections. But the rules don't get blurred. They end at certain town lines.
Yeah, the one point I thought it made well is some of the arbitrariness that we have to grapple with, where, if we ban people coming from Rhode Island, but we allow people intrastate travel, where a local community may have a significantly higher infection rate than another state. But the reality is a lot of these, the smaller the unit that you're dealing with, especially when you come down to something the size of Westborough, you get a lot more variation in your data. And so you're always going to have your smaller towns will tend to be the least infected and the most infected, because they have the most variance from the average. Okay, Steve, what else you got on your list for us?
So not a whole lot more, just one, and I'll let Aaron kind of tell this one thing. So you're up, Aaron, I guess.
Sure, thank you. So I have good news, sad news. I was offered and accepted the job as the health director in Uxbridge. So I will be starting that at the beginning of the year. January 2nd, I think, is my first day.
You're going to be busy doing both jobs, aren't you, Aaron?
I'm super happy to help here in the meantime. And I said I can definitely help in the, so the health director job in Uxbridge is part-time, which right now for myself and my family is a better fit. And it's an exciting opportunity. So
congratulations.
Congratulations. I mean,
the downside,
you've been here, you got another degree, you got this job. This is just great.
It's been a busy year.
Nathan, we couldn't quite hear you. You want to repeat what you had to say?
Say that, that sounded like a downside for Westborough. I was waiting to hear the upside.
The upside is that I will have time to spend with my family, I'm hoping.
Good for you. And so, Steve, that obviously means that we're going to have to kick off looking for a new.
It's going to take two people to replace Aaron.
Yeah, well, I mean, I gotta say, I mean, Erin's been vital in the past 3 weeks as far as my sanity with, really just stepped up with the contact tracing, her and Ray also. But yeah, we're gonna have to, get the announcement out there to try to fill that huge gap, as soon as possible. So I've talked to HR, and they're working on it.
Okay.
But can I also just point out something? Correct me if I'm wrong, Ray. You're also the director of public health, or in your town. Am I right?
No. I work for 4 other towns, but I'm just a sanitarian and health inspector in the other towns.
I think what he might be referring to is you had been on the Board of Health, I think, in Auburn. Is that right?
In Auburn?
9 years, I was the chairman of the Board of Health for Auburn.
That's what I thought. We have a pretty good track record in this board of leadership. Well done.
We train people well, I hope. So Erin will be able to take everything she's learned here and, go off and set roots down in Uxbridge, I guess.
Well, you're not moving. You're just, right? No.
No, I will still be a resident of Westborough.
Awesome.
In that regard, when a new person, when the position is being advertised, I wanted to briefly get input from the board as to what, if any, role the board wanted to have. I think this is primarily a decision of Steve's, but if we wanted to have perhaps one of the members of the board participate in interviewing or not, we could just be informed later on. Obviously, the last time they hired Erin, Steve and Ray were very judicious in selecting a very highly qualified candidate who turned out to be a superstar. And, we can simply leave it to them again, but I wanted to just get a sense of the board as to what people thought best.
So I've got full faith and confidence in Steve and Ray to help select a new person. I am also extremely busy the next couple months myself, and so I probably do not have time to do extensive interviewing with lots of candidates. I'd like to meet whoever they're, in their final rounds, but in terms of interviewing all the candidates, I don't think I can be a part of that.
Any thoughts, Ed, from you?
I'd echo exactly what Nathan just said. But, if you're looking to get involved, I would back that up. I mean, I trust your judgment.
Yeah, so I'm not looking to get involved, but I will simply offer myself, as a sounding board. If you want any opinions about anyone, or you're down to 1 or 2 candidates and you have a question, I think I can represent the board's perspective. But I think, I agree with what Nathan said, that you and Ray can take the lead, and we trust your judgment.
Okay. Well, thank you. And again, Erin, we'll sorely miss you, and congratulations.
Okay, Steve, any other news?
No.
I had a couple things that might fall into director's issues. One is with winter here / approaching, normally we have plans for emergency shelters that happen in the winter. In light of COVID, if something were to happen and part of the town were to be out of power and it'd be really cold, do we have a plan? How are we going to adapt the plan? There are mask requirements, or people are sleeping overnight, just logistics that I'm not sure we've thought about, or maybe I haven't thought about and you guys have.
Yeah, I haven't either. We've been very fortunate over the past numerous years. Whenever we've opened shelters, we don't get a whole lot of people coming, and that's something that I think I will reach out to the emergency preparedness director, who is Pat Purcell, and talk to him about. I just think obviously it's more of a spacing thing, quite honestly, Dr. Walsh, I haven't thought about it either. So you got me there.
Okay. It's probably worth a little bit of thought so that we don't get caught too flat-footed. I think most things in life, what we want to do is balance risks. And obviously the risk of freezing to death versus the risk of getting COVID. Freezing to death is pretty quick and, pretty bad. So, it might still be a better option to come to a warming shelter for whatever length time is needed. But yeah, we probably do need to kind of think a little bit about what rules we want to put in place at the shelter.
I think this is an excellent point you've brought up. And in the past, we've relied on the senior center, and we have had the ability to use the high school gym as a shelter or whatever. And it seems like that would be more prudent to make our plans centered around that, and trying to understand what the logistics would be, what the requirements should be for when we would need to activate something like that.
Okay. Yeah, I'll have a discussion with Pat about it. As far as what we think might be best.
And the other issue that I wanted to bring up more, I think, for the board to talk about than something specifically for Steve to act on is as we get to the point where kids are being vaccinated, which we're not there yet, but when we do get there, as far as I'm aware, the school department still doesn't have a full in-person plan yet. And I wanted to know if the board wanted to, make some sort of more formal demand or recommendation to the school department to get that plan so that it would be ready if if they wanted to implement it. I don't want to overstep the role of the Board of Health here, but it does seem like with the vaccine approaching that would make sense.
Yeah, I think obviously the word demand is probably a little strong given the scope of our authority. I think as we learned the last time, we can make recommendations if there are contractual issues, or at least even if it's not formal contractual but negotiated agreements. That I think is a challenge. Obviously, Amber has to work through. I think it's just a little premature until we see the vaccine rolling out more widely. Right now, it's going to be targeting very selected groups. But when I think you start getting vaccines into doctors' offices and it's a reasonable expectation that children can be immunized and then return to school, then I think as at least when that's on the horizon, I think your suggestion makes sense.
Well, I want to take a little bit of an issue. I think that it is on the horizon. It's not here yet. But making a plan, I think, takes time. And so if you wait till they're actually vaccinating the kids, at that point, you might not have the time to make a plan and then enact it in a way that would get the kids in school. I mean, there is a health and safety aspect to getting the kids socialized and getting them, into schools and into classrooms from mental health perspective, as well as, having the kids not get set too far behind.
I guess I have with only the Pfizer vaccine being approved at this point, my expectation is we got a longer runway to where you're projecting. That's the only difference I'm saying.
No,
I'm not opposed to a plan.
So if the goal is we want to table it for a month or two, I think we can do that. I just don't want it to, be March and then have us, at that point trying to decide, what to do for, 2 months.
Yeah, I think it's fine to bring it up at the next meeting and let's see where we stand.
I'll table it then.
Any other issues people wish to discuss?
Yes, Dr. Ehrlich could say it.
Yep. Go ahead.
So one of this is just a personal item. I just wanted to discuss with the board. As you're aware, my term is going to be coming to a close in next year. So I was wondering, wanting to get off the board. I think it's time. I think it would be time for some new blood. I ran on it's something that I believe in very strongly. So I was trying to get a sense from the board if it would be okay if I step down after the March town meeting, so that would allow me to, potentially plan for the March town meeting, and then at the close of that, step down from the board. It has been a true privilege to serve alongside of you. I've learned a lot. There's still a lot, that I want to do, but I also want to realize that, part. I think it's important that we do get some new blood and to give someone else a shot. And so I wanted to raise that, get your sense before I reach out to Christy, the town manager.
Go ahead. Anything if you want to say something else, I'll start.
If you let me, I will. Sure. I was going to say that, Syed, we appreciate you being on the board. I think that we've invested time and effort into teaching you a lot about the board. I've learned a lot since I've been here. Starting over is always hard with bringing in a new person. So from that sense, I think we'd love to have you stay. Obviously, if you think it's time to move on, though, then I mean, I don't think it's quite my place to tell you that you can't leave. So, you know, I think that you have to make your own decision about what's best for you. But no, I think that as far as the board, you've brought in a very different set of interests and skills than we had on the board before. And I think that, you know, that diversity has really helped the board. And so I hate to lose that.
And so, first of all, I would echo what Nathan's saying, but what I would say, Nathan, Syed, is, first of all, obviously you do what's best for you, and, you know, the chance for others in town to participate, I think, is healthy. And, you know, your role of being on both the Board of Selectmen and the Board of Health, I think at times makes it difficult for you, where you have to choose what meeting am I going to, or this or that. And I think you're doing a fine job on the Board of Selectmen. I know you're coming up for re-election for that. And so ideally, you know, you'll be able to, you know, continue in your role as a public servant and continue contributing to the town of Westborough. So, but it's not clear to me, why would you step down in March instead of just finishing out your term at the end of June?
Okay. I was going to say that, you know, if I step down in March, maybe it would give someone, you know, I could mentor them along, or do you think just finish out my term in June?
I would just finish out your term. If we know that you're not re-upping, we can start advertising for a replacement in May, and even have somebody before they, you know, if we've selected somebody, they could attend a June meeting and see what's going on even before they formally start, that kind of thing.
Okay. Well, oh, my goodness, I thought you'd be like jumping for joy to get rid of me, man.
You know,
Good God.
Let me just tell you, you know, people talk about diversity, and diversity is an important thing, but there's, amongst the diversity that you bring to this board, is diversity of thought, diversity of opinion. And I think that's always been a source for constructive dialogue. And, you know, I think the three of us have been very respectful of differing opinions, and that's what makes for a healthy board, a successful oversight of the department. And I think that's been something good. So,
oh, let me
I hope you feel the same way in terms of, what's that?
This is my favorite board, man.
Mine too.
Mine as well.
All right, then. That's. Thank you both for your feedback. Then I will go along those lines. Then, okay.
All right. If there's nothing else, I would entertain. Let's discuss the next meeting. If we can just look at our calendars. I think the next one typically runs up against, not against, but it's adjacent to the Martin Luther King holiday, so it would be the 19th.
Right.
I don't know if that's an issue for anyone, or if that's a convenient time.
I have no travel plans for the next, 6 months or so. I'm not even getting together with, didn't get together with anyone for Thanksgiving other than just my immediate household. And it seems like that path is going to be holding forward. So yeah, the 19th works fine for me.
Okay. Sid, does that seem good for you?
Yeah, that whatever. Just
let's do it.
Have Paula send me an invite or something.
Okay, so it's set for January 19th, Paula, and then I would entertain a motion to adjourn.
Yeah, okay. I make a motion that we adjourn.
I second that. I second that
The
motion.
alternative is we sit around and we reminisce about all the fun we've had with Erin over the years.
And, wait, hold on a second. I'll just before that, I do think that the board should recognize, send a letter thanking Erin for her years of service to the board. With at least before we go, can we agree on that?
Yes.
Yep, I'm over that.
You want me to make a formal motion, Syed?
Yes. Yes.
I move that the Board of Health of Westborough recognize Erin Hightower for her service to the town of Westborough as a health inspector, and we commend her for her diligence and hard work in particular in regards to helping during the COVID pandemic. We wish her
protecting the health of the residents of Westborough and protecting the health and wellness of the residents of Westborough.
Residents of Westborough. We wish her the best of luck in her future endeavors, and she has our warmest fond farewell.
I'll second
I
that.
second that.
Can we have that framed? Can we get a little frame for it? I'll stop that. I'll stop at the framing store and pick it up. Paula, you just printed out something nice. Okay. With that, I'll take a motion to adjourn.
I think we have a motion. I second the motion.
Okay. Dr. Hashmi?
Yes.
Dr. Walsh?
Walsh, yes.
And Dr. Ehrlich, yes. Okay.
Well, everyone, take care. Bye.
Thank you guys for the hard work. Keep up the weekends if that works for you guys. Appreciate it.
How about get some rest on the weekends? Especially Mr. Bakari.
Yeah.
Bye.